Dr. Brandon. May I call you Marianne?
Oh, yes, you may. Dr. Morgentaler, may I call you Abe?
Oh, please do. It's so good to be on a first name basis with you. Listen, I can't wait to do
What
this.
do I say to that?
I can't wait to do this podcast with you.
Yeah, it's an important one. It applies to everyone.
Well, I can't wait to hear what this is about.
Well, you know what? We're going to talk about sexual changes that happen with age.
Before we start, a small disclaimer. The Sex Doctors podcast is not a substitute for medical or psychological advice.
And the reason I wanted to do this is we answered a question. I think it was the last time we taped, a listener question, and they were asking, like, they didn't have a pretty active sex life. They were older. I don't remember how old, but we answered it. And the problem with these questions, we love the questions.
We love your questions.
We
Keep
love
them coming.
them.
Keep them coming.
But they can be hard to answer succinctly. And so we answered.
Hard for us to answer.
Yes, because there's always a lot
We
to
have
say,
so
right?
much to say.
Well, but sex is so complicated.
Yeah.
You know, there's biology, there's emotion.
Psychology.
Oh, there's just so much. So anyway, we answered it. But as soon as we finished, we went on to whatever the topic was. And I felt bad because we really didn't address like biology at all. And that's an important part of what happens for people sexually as they age. And it's not discussed very much. People don't really know what to expect necessarily with what's going to happen, like to their genitals and stuff like this. So I thought this kind of like will close the loop on that question that I felt we just really left so much unaddressed.
Okay.
So we're just going to jump in and talk about these changes that people tend to experience with age. And then I want to hear from you, what your take is from a medical perspective. And then we could talk together about what you could do about it.
Great plan.
Okay. So I have these, I'm actually reading from slides. I give a lecture to therapists about sex therapy. And one of the things we talk about is sexual changes with age. So I'm just going to read from my slides just because it's so simple to do.
Sure.
Okay, so sexual changes for women as they age. So we're talking, and this stuff happens gradually, but people probably notice it most around age 60 and older, but these changes don't just happen overnight. So decreased lubrication. So lubrication for a woman is a way it's when she's aroused. So when she's aroused, she has, and that's the body's response to desire. She has increased blood flow to her genitals. She has lubrication. And so she'll notice as she ages less lubrication, vaginal atrophy. So that means that her vagina the pH of the vagina changes. She can be more apt to get yeast infections because of thinning of the vaginal wall. She could bleed during sex, or just simply feel chafing during thrusting.
And this is the result of not having the hormones.
Right.
So women who are on hormone replacement therapy, this may not happen the same way.
Well, that was our big reveal. So because there's more.
I just blew it. Okay.
Yeah.
But the point is that there's some hormonal changes, and
but there's more.
Oh, there's more. Yeah. Okay. I'll let you finish.
Okay. So less intense orgasms, decreased sensitivity of the clitoris and nipples, and less pubic hair.
Yeah.
Should we go on to the men, or just do you want to start?
Sure.
So men, very similar kinds of things, but just because their genitals, it's going to show up differently. But they need more stimulation to get erect and to ejaculate. They need more time between ejaculations. That's called a longer latency period. So they might be used to ejaculating twice a day, but they might find with age they're maybe every other day or something like that. Less ejaculate volume, less rigid erections. They perceive often penile shrinkage, but you don't necessarily agree with that. I think that we've talked about that before, so I'll be curious on what you say. But I think that less blood flow to the penis would make them feel like their penis was smaller, right? Collagen deposits that can happen in the penis would potentially inhibit blood flow, again, make them feel like their penis is smaller. And if they've gained weight, they don't see their penis like they used to, so they feel like their penis is smaller, these kinds of things. But anyway, you can add in on that. Decreased sensitivity to the penis, and again, less pubic hair. So that's a lot of stuff, right? And it's kind of bad news. Nobody really wants to think about that.
Yeah. Well, listen, aging sucks.
Yeah.
I mean, can we summarize that way?
I think so.
Yeah. And there are things that we can do,
Absolutely.
right? I mean, but the clock is ticking on all of us. And one of the most important things is hormones, right? So a lot of the changes that we see in men and in women are from decreased levels of the sex hormone.
Right. And that's what's really good news. This stuff sounds so depressing, but so much of it can be mitigated with hormone therapy.
Yeah. So for women who are postmenopausal, for sure, HRT, hormone replacement therapy, can be fantastic and can avert many of these changes that you've gone through. Not all, but many.
Right. And even if she doesn't want to take hormone therapy that's going to impact her whole body, she can have like hormone therapy just to her genitals in like a cream or something that's made up by pharmacists.
Vaginal estrogen is very useful for a lot of women,
Mhm.
and the FDA just removed its big deal with just removed its black box warning around that it has still for systemic estrogen about breast cancer and things like that. But the stuff that's applied to the vagina is only working locally. It's just working down there.
Mhm.
Like it doesn't go to distant parts of the body, whether you are or aren't afraid based on the data of other things happening.
Right.
So extremely safe.
Right.
And also a big source of prevention of urinary tract infections that happen a lot
Yeah.
in women as they get older.
And then can be very dangerous. It's not like
People die of sepsis from urinary tract
Yeah.
infections. Yeah. So and even if it's not that it's a terrible nuisance and feels awful, right? And then people get treated with repeated bouts of antibiotics. And so listen, if we can prevent it, it's a lot better.
Right. And I didn't put libido on this list because these were focused on the physical changes, the
Yeah.
body's changes. But so many people report lower libido with age, which again can be addressed by hormones. Not,
Yeah.
not completely. Hormones aren't going to take 100% of this away. We don't have that ability.
Yeah.
But so much of it that people can sort of like do what they need to do to keep their sex life exciting
Yeah.
because they have that support of the hormones.
Yeah.
But anyway.
I paid attention when you said, but the penis getting smaller. So I'm not convinced that that's
Yeah,
true.
we've talked about that.
There are some conditions that can occur with aging, like Peyronie's disease, which is like scar tissue within the chambers of the penis that can shorten the penis. So for people get affected by that, yes, the penis can be shorter. But if you don't have that, maybe not. Men who get radical prostatectomies, penis gets smaller. Radiation therapy can affect it. But really what's happening for a lot of these men is that the erections aren't as firm, even with Viagra or Cialis. And so they don't see the penis necessarily quite as full, quite as hard. When a penis is hard, what really happens is that there's so much blood flow and the pressure increases that the tissues are expanded to the max. To the max, because what you really need for a penis to be rigid enough to go inside wherever it's going to go inside.
We shouldn't giggle. Like, I don't think that was appropriate.
I'm giggling at my use of language,
Well, me too.
not at the act.
Yeah.
But what it needs is rigidity, and rigidity reflects the pressure within the chambers, not blood flow. So if somebody could have great blood flow into the chambers, the erectile chambers, but if they can't trap the blood and it's escaping, they don't have a good erection. You have to trap the blood, and what that allows is for it to become firm. So as men get older, their ability to trap blood decreases. We call that a venous leak. Some of the blood gets out. And so the penis never has the internal pressure that's going to expand it fully. And the other thing you mentioned is people gain weight as they get older. It's just, you look at the data, it's just a natural progression. Not for everybody, but on average. And most of our penis is hidden from us. We only see the part that extends out from the lower part of our abdomen, from the pubic area. If you gain weight, there's a fat pad there that can get thicker and it can hide some of the penis.
So, right. That's very interesting, very fascinating. But it is. But so step one is hormone therapy, right?
For a lot, yes. I never want to be in a position where I say everybody should be on hormone therapy.
Yeah.
But listen, if you're a man, let's talk about men for a second. If you're a man and you've got symptoms, sex drive is down, you're tired beyond what makes sense to you.
You don't wake up with erections in the morning.
Yeah, and your mood is like off, and you become a grumpy old man before your time.
Yeah.
And you get your testosterone levels checked, and they're low. What I can tell you is that there's about an 80% chance that you're going to see some benefits that are probably going to be, good for you.
Hmm.
There may be health benefits that may take years to show, that may be helpful beyond that, but most men are going to see something,
Hmm.
experience something that's beneficial. So do you have to do it? No, you don't have to do it. But if these things are bothering you, get them treated. Why not?
Hmm.
Overall, testosterone therapy is very safe.
Right. Okay. So
And for women, HRT can take care of an awful lot of problems,
yeah.
right? And make people feel better and their bodies are happier, their skin is better, hair is better,
Hmm.
sex is better.
Hmm. Okay, so that's one approach to dealing with these changes. Other things that I think can be very helpful for people is just to work with what's happening. So if they need more stimulation to get aroused, that just means that they need to kind of plan for more time for sex, plan to have more foreplay, maybe get some new sex toys that'll amp up stimulation. And those go for everybody. There's sex toys for everybody now today.
For everybody.
Yeah. Everybody. Yeah.
Oh, that's very good,
Yeah,
Dr.
yeah,
Danda.
yeah.
Yeah, everybody. Yeah.
So, just bringing that different, mindset can go a long way with, and also, sex therapists always say, don't be so focused on the orgasm, be focused on the process, which
Right.
there's very much truth to that, although it's difficult for people to,
And don't they also say don't focus so much on the genitalia?
yes, they
Don't they
do
say
say
that,
that.
those sex therapists?
Yes, yes, yes. Those sex therapists say
Yeah,
that too.
yeah. Because there's a whole experience that's going on.
Right. Yeah, there is. And one of the homeworks I give people to kind of understand that is I tell them to have sex with their clothes on, which is really just an experience of sensual connection.
Reminds me of high school.
Yeah, it is like that. And that was pretty sexy, right?
Absolutely.
Yeah. So that's
Yeah.
that's the point.
Yeah.
So that's a great exercise for people who feel like they're getting older and kind of have lost some of the excitement to sex. Kind of dial it back a bit and start back with that and see how much that can be as intense as intercourse with eye contact and very mindful touch.
Yeah.
So there is the bottom line. There's a lot people can do. There's a lot of change that happens, but there truly is a lot people can do to counteract it. And that's not a spin. That's reality.
Listen, I appreciate your take on all of this stuff, and I'm sure that our viewers and listeners do too. Yeah, we don't. This is a no spin zone.
It is. It's a no spin zone.
Spin free zone.
It is.
Yeah, we
That's
just
right.
tell it like it is. That's what we have to offer.
That's true.
Yeah.
It's good.
Excellent.
Yeah.
Anything else you want to add?
No, I think that's it. So now I feel like
So
my
can I
answer to our
summarize? I'm going to summarize.
Okay.
So listen, so things happen to men and women as they get older
Mhm.
that can affect their sexual desire, but also their bodies.
Right.
Some of those things can be treated, dealt with nicely with hormones. Some of them not. And to a great extent, we have to make do with what we've got. It
Mhm.
may not be exactly the same as when we were younger,
Mhm.
but if you're in a loving relationship or you have a loving partner, you can still enjoy sex a whole lot.
You know what? Absolutely. And I didn't mention vaginal dilators. I think I should before we get off the call.
Please,
Because
please.
So vaginal atrophy means the vagina sort of shrinks with age. Atrophies. Would you say any more to that to describe vaginal atrophy?
Well, you're talking about a dilator, so it can narrow.
Right, narrow.
Yeah.
Okay. So what
That's not, so atrophy is the tissue actually isn't behaving the way that
it's not supple like it used to
Yeah,
be and that
exactly.
sort of thing.
Yeah.
So dilators they would get from probably their gynecologist. You can get them online, but it's generally recommended that you do this in conjunction with sort of a physician's or your medical practitioner's awareness. But dilators are like little dildos. So for women who haven't had sex in a long time and their vagina starts to shrink, they can start to get their vagina used to accommodating more if they start with these dilators and start with a small size, add lube, and get her body used to having that inside, and then move up in size of the dilators
Right.
till she gets to a size that would accommodate what she's wanting to accommodate, her partner's penis or whatever. And so that's a process, but it's very helpful for people.
Yeah, particularly useful for women who have not been sexually active. Maybe they've divorced and remarried or want to remarry. They're dating again, and
Yeah.
yeah. And I like your comment. So there you can get dilators, on your own without a prescription.
Right.
By and large, the ones that you're going to get through a physician are going to be higher quality, medical grade, if you will. But you probably can get some good ones on your own too. But I think going with a physician is a good recommendation.
You don't want to hurt yourself.
No, and don't force anything.
Right.
And it's supposed to be a gentle process.
Mhm.
Yeah. Excellent. Well, you've now listened to another episode of
The Sex Doctors.
And we would so appreciate it if you like this content. Go to our website, which is
thesexdoctorspodcast.com.
and subscribe, give us a like. You can write your questions and your comments there. And we hope to see you again for another episode of
The Sex Doctors.
Bye-bye.